Hello everyone, welcome back to our YouTube channel Mano Vigyan. I'm your psychologist friend Shreya. So this week is the topic that is really important, and this is something which every second or third person faces in our country, that is migraine. So today we are going to talk about migraine and its psychological causes. I'm pretty sure you would have come across so many videos where people would tell you home remedies to cure migraine or what kind of medicines you should take to cure migraine. But understanding the deep root cause is something that is very important. So to understand that, understanding psychological causes does become very important. So today we are going to talk about migraine and its psychological causes. Not just that, we'll also be talking about how to deal with migraine. That is how to eradicate migraine. So we'll be talking regarding some of the ways. So before we jump into anything, let us try to understand what is migraine. So migraine is nothing but it's a headache where it comes in various intensity. You have headaches in various intensity. For some people it is quite light and for some it is really bad. It goes for days together. The pain is really bad and terrible. And it is usually accompanied with nausea and sensitivity to light and sound, where the person feels very sensitive towards light. He doesn't want to see light and stay away from light and sound. That's why usually you see that people who are having migraine tend to avoid light and sound, and they just want to be in a peaceful place. So that is regarding what migraine is all about. So, what are the symptoms basically? So, understanding the symptoms is very important because what happens is some people they don't recognize it and they feel that, oh, it's a normal headache, that could be because of some other reason, and they tend to ignore it, and that becomes really severe. So, understanding the symptom is very important. So, first symptom is pain in the eyes, face, or neck. Some people experience pain in the eyes. Some people may feel that strain and extreme muscle tension and pain in the neck as well as in the face. Second is there is throbbing headache. There's frequent and throbbing headache. So you can see that you feel like somebody is hitting inside your head. I'm pretty sure people who would have gone through migraines understand this. They feel that somebody is hitting a hammer on their heads. So there is frequent and throbbing headache and it is very acute in nature. So, as I said, sensitivity to light. They just want to stay away from light and they feel very distorted vision. They can't see anything properly because that pain will make them close their eyes. And they're very sensitive to light and sound, as I said before. Dizziness, some people do experience this because of the severe pain they experience. There is a sense of dizziness that is seen in an individual. So, these are some of the symptoms. I'm pretty sure you would be curious to know that who does get the migraine, like which gender is more prone to migraine. It can be seen here that women are more prone to migraine. As you can see, that from the age of 18 till a woman greater than 75, they do have migraine attacks. And you can see the comparison here. The gray bar is of men, whereas the blue bar is of women. Through the start, you can see from the age of 18 to 44, the women are having a greater amount of migraines. It is double the number. The gray graph is of women, whereas the blue is of men. So you can see that the number of migraines that you see is seen more in women and not in men. Men do have it, but it is because of the hereditary factors. That could be that their mothers had migraine in the past, or they have a family hereditary of migraine. So you can see it is more seen in women and it is more prone in women than in men. So your next question would be, okay, then why is it seen only in women and not in men? The hormonal changes basically plays a very important role. As women, all of us go through menstrual cycles, during before the menstrual cycle happens, there's fluctuation in your hormones. After the menstruation cycle is over, there's fluctuation during your pregnancy. I'm pretty sure During pregnancy, women go through lot of mood swings, lot of changes in their body, everything that is because of the hormones, and as well as during the menopause. So women report if they have more painful and longer lasting headaches. The hormone that gets fluctuated during this time is the estrogen. Due to the fluctuation in the estrogen, women are more prone to migraines than to men. So this is the specific reason of why women are more prone to migraine than men. So this is basically the structure of the estrogen hormone. So this is the example of it. So what are the other psychological causes of migraine apart from the hormonal changes that's seen in women? As I told you before, it is also seen in men. It is hereditary factor, but there are also other factors that are involved. The work stress, as we all know in today's world, the work stress is really bad because nowadays we are so much connected with our technology. Technology has made things very easy. So you're expected to work at work as well as at home at times. The schedules, the work stress, the commitments, the targets. So these are the work stress. Due to this, also people tend to have migraine attacks. Home stress, pretty sure, there may be problems in the family, or, it could be any other problem with the children, with the spouse, or any of the family member. So, prolonged stress at the home environment will also cause migraine attacks. Relationship difficulties, not just between a girlfriend or a boyfriend or a husband and a wife. The relationship difficulties could be between anybody, a father and a daughter, a son and a mother, anybody it could be. So difficulties in this relationship will also lead to prolonged distress and stress, which in turn will be showed up in a physical form, that is your migraine attack. Anxiety. Yes, we are living in a world where we are highly stimulated to things, and there's a lot of stress and anxiety. There's a lot of competition. Because of that, people go through a lot of anxiety. So because of that, also high levels and prolonged anxiety, that is when you have anxiety for a really long time, there are chances that you may end up having migraine attacks. Depression. Yes, if you are going through a phase where you are depressed for a really long time, where you don't feel like doing anything, you have lot of negative thoughts, you're overthinking. So that overthinking and negative thoughts will definitely lead to migraines. So how do you deal with migraine? So relaxation technique. So relaxation technique is not just about meditation. Relaxation technique is a proper procedure that gets followed where you are made to sit down, close your eyes, relax, as well as there's a certain procedure that is followed where, for example, you are told to strain your forehead, then release that strain of the muscles from your forehead, and then try to understand how relieved are you feeling. So like that, the training is given for long periods of time so that the migraine attacks will reduce, and it will also help you to calm yourself and deal with the situations better. So biofeedback training. So what happens here is basically there are electrodes that are given, like that are placed on the individual. As you can see, there are two electrodes on the head, on the finger. So here what happens is in biofeedback training, they will try to understand the functioning of the body. For example, where is the muscle tension, or how the body is reacting to stress. So when they work on that, what happens is it becomes easier to understand the root cause of migraine and work on it so that it will be helpful for the individual to overcome and as well as completely eradicate migraine. So cognitive behavioral therapy, here what happens is they will help an individual to understand their problems as well as try to change their view of how they look into it. For example, if an individual is facing stress at work, the person may be always like stressed and cribbing. oh, this is so difficult. Long working hours, I'm finding it very difficult to manage. So in CBT or the cognitive behavioral therapy, they will here try to help the individual to change their thought process. That is, instead of looking that work as stress, how do you help them to deal with it? They will try to change their thought process. That is, instead of taking as stress, take it as a challenge. Take it in such a way that you can improve upon yourself. So the main aim or the agenda is to change that negative thoughts towards a particular thing to more positive. So this is electromyographic. So this is very similar to biofeedback. So what happens is here, but this is more specific. So what happens here is basically, as I said before, there are electrodes which I showed in the previous picture. So electrodes are placed on the head, on the finger, especially for the migraine. Sorry, it is usually placed on the neck. Behind the neck, the behind your neck, skull. You know. So when it gets placed, they will try to understand the activity of the muscles. Your next question could be that can this be done during the migraines or when the individual is having migraine headaches? Yes, it can be done during migraine also. Here, the main purpose is to understand how the muscles are working. For example, when there is migraine, which are the muscles that are getting strained? You know, which are the muscles that are getting strained, and how can we work on it to help an individual to overcome migraine? So, electromyographic is used for the same purpose. So I hope you liked a small video which is regarding migraine and its psychological causes. And we also spoke about how to try to find the root cause of migraine and as well as help the individual to eradicate migraine. So I hope you liked our video. If you have liked the video, please do comment so that we can improve upon upcoming videos. Like, share so that we can reach more number of people with more interesting psychological topics like these. Subscribe as well as don't forget to hit the bell button to get further notification from our channel. So until the next time, you take care. Stay happy, stay positive. Bye bye.